Namaste. Today I'll be talking about frequently answered questions on COVID-19 vaccination. The answer will be based on the Ministry of Health and Family Welfare, Government of India. The very first question is, will COVID-19 vaccine be given to everyone simultaneously? Government has identified a high-risk group to be vaccinated on priority. The first group includes the healthcare and the frontline workers. The second group will be a person over 50 years of age and the person with comorbid conditions. Subsequently, the vaccine will be made available to all the others in need. Will the vaccine be safe as it is being introduced in a very short span of time? Vaccines will be introduced in our country only after the regulatory bodies clear it based on its safety and efficacy. Is it mandatory to take vaccination? Vaccination for COVID-19 is voluntary. However, it is advised to receive the complete schedule of COVID-19 vaccination for protecting oneself and limiting the spread of disease among the community. Is it necessary for a COVID recovered patient to take the vaccination? It is advised to receive a complete schedule of COVID-19 vaccination irrespective of your past history of infection, as it will help in developing a very strong immune system. Can a person having a COVID-19 infection, either a confirmed or a suspected, to be vaccinated? Infected individuals should defer vaccination for 14 days after symptoms resolution, as they may increase the risk of spreading of virus to others at the vaccination center. Does India have the capacity to store a COVID vaccine at +2 to +8 degrees Celsius and transport them at the required temperature? To be very frank, India runs one of the largest immunization program in the world, catering to the vaccination need of over 26 million newborns and 29 million pregnant women. The program mechanisms are being strengthened to effectively cater to the country's large and diverse population. Will the vaccine introduced in India be as effective as the other countries introduced? Yes, COVID-19 vaccine introduced in India will be as effective as any other vaccines developed by other countries, as various phases of vaccines trials are undertaken to ensure its safety and efficacy. How will I know if I am eligible for vaccination? Eligible beneficiaries will be confirmed through their registered mobile number regarding the health facility for vaccination and its scheduled time. Any of the photo ID card is mandatory at the site of vaccination, which can be either an Aadhaar card, driving license, voter ID card, PAN card, passport, job card, pension document, or any official ID cards issued by MPs, MLAs, MLCs, passport book issued by the bank or a post office. Can a person get a COVID-19 vaccine without registration? No. Registration is mandatory for COVID-19 vaccination. Only after registration, the information on the session and the time will be shared. Photo ID card is a mandatory for both registration and verification at the center to ensure the intended person is getting vaccinated. Which is, how will the beneficiary receive an information about a due date of vaccination? Following online registration, the beneficiary will receive an SMS on the registered mobile number on the due date, place and the site of vaccination. Will the beneficiary receive information on their vaccination status after completion? Yes. On getting due dose of COVID vaccine, the beneficiary will receive an SMS on their registered mobile number. After all the dosage of vaccination is completed, a QR code based certificate will also be sent on your registered mobile number. Are there any preventive measures and precautions that one must follow at the session site? Yes, very much. You must rest at the vaccination center for at least half an hour after taking COVID-19 vaccination. Inform the nearest health workers, ANMs or ASHA workers in case you subsequently feel any discomforts or uneasiness. Remember to continue the COVID protocols like wearing mask, frequent hand sanitization and physical distancing of about 6 feet. If one is taking medicine for illness such as cancer, diabetes, hypertension, etc., can he or she take a COVID-19 vaccine? Yes, persons with one or more of these comorbid conditions are considered as high-risk categories. They need to get COVID-19 vaccination at the earliest. Will the family of an healthcare worker, providers and the frontline workers also be given a vaccination? Right now, due to the limit vaccination supply in the initial phase, it will be first be provided to the people in priority group, that is healthcare workers and the frontline workers. In subsequent phases, the vaccination will be made available to all in need. How many doses of vaccination would have to be taken at what interval? 2 doses of vaccines, 28 days apart, need to be taken by an individual to complete the entire vaccination schedules. When would antibodies develop after taking the dosage? Protective levels of antibodies are generally developed 2 weeks after receiving the second dose of COVID-19 vaccination. I hope I have answered all the questions which is generally asked, and if anything, please put it in your comment box so that I can answer it. Thank you so much. Namaste.